Governor Scott Walker is being criticized for his handling of the state's Medicaid program. A local lawmaker says the governor's actions have already cost the state hundreds of millions of dollars and could cost hundreds more. News 8's Mark McPherson is live in our newsroom with more. Mark?
Mike, State Senator Senator Shilling is referring to a report released by the Legislative Fiscal Bureau. It says the governor's refusal to fully expand Medicaid has already cost the state more than $200 million. She says if the governor doesn't act before the next budget, the state could lose a whole lot more.
I hope it gives he and his administration some pause.
State Senator Senator Shilling sees this recent report as an opportunity for the governor.
I would like to see the governor have a frank discussion with his administration and with the federal government in finding a way that Wisconsinites could utilize this money.
Under the Affordable Care Act, if a state fully expands Medicaid to low-income families, the federal government will fully cover the cost. But Governor Walker only partially expanded the program, losing out on the funding. That meant paying $206 million more in costs. The governor said his decision was made in part because he doesn't trust the federal government to make good on their promise to pay.
Anybody who thinks that a government at the federal level that's that far into debt and operating in a deficit is going to come through with the promises of new money at a time when they can't even make the current commitments they have, I think is living in a bit of a fantasy world.
I think that is really ridiculous and a very weak argument. I mean, that's like saying that we're not going to believe that the federal government is going to come through on money for federal transportation dollars.
But the discussion of what would have happened is taking a backseat to what could happen. The report says if the state continues with the current program for the next budget, they could lose up to $315 million. While the governor hasn't said whether he'll reconsider, he does say the current plan is helping.
The reality is we were able to do the things the Wisconsin way to cover everyone living in poverty for the first time in our state's history and not expose Wisconsin taxpayers to higher costs in the future.
Now, what the governor is referring to in that last statement is to reforms he put in place for Medicaid. Walker opened up the program to tens of thousands of childless adults living below the poverty line who were previously locked out because of a cap on the number of members. Mike?
All right, thanks a lot, Mark. And the governor has also blocked anyone who lives above the poverty line from signing up for Medicaid. He says they are eligible for health care on the federal online marketplace.